Welcome to Thursday's edition of COVID-19. The daily tally is hovering below 1,000 for the third straight day, but authorities are on high alert as the number of patients in serious and critical conditions remains relatively high, raising concerns of the potential rises in the death toll. Now, this is an issue that we are poised to touch upon later on in the program. I have our Kwonsua standing by now with the broader pandemic coverage. So I'll just start us off with the local situation.
Well, Sunny, although we are now in the latter half of the work week when we usually saw a pattern of rising cases, this Thursday numbers have not soared all too much. It stands at 870, the number of infections. And so far, there were only 2 days in this year so far when we had numbers at above 1,000. And as Sunny earlier mentioned, for 3 consecutive days, the numbers were below 1,000. And with that, the average number of daily cases in the past week has dropped to 850, and accordingly, the domestic transmissions have also declined, now standing at 818 on average between January 1st and January 7th. And the accumulated number of cases in the country stands at 66,686, the death toll at 1,046, with 19 patients having lost their life in the past day. And out of almost 18,000 people in quarantine, there are currently 400 in serious or critical condition. Now, this Thursday, we again see the highest number of infections in Gyeonggi-do province, not much different in Seoul, both at around 300. Also, double-digit figures in Incheon and also many other places across the nation. Now, meanwhile, as the country is also currently dealing with a cold wave as well as heavy snowfall, temporary screening centers in the metropolitan region will operate at shortened hours from today until Sunday from 11 a.m. to 3 p.m.
I see. So I hear there's also been a slight change regarding social distancing guidelines at certain facilities.
Right, Sunny. Restrictions at indoor sports facilities will be eased, as many of those places had to close for around a month now due to stringent social distancing measures at level 2.5. So beginning tomorrow, gyms, swimming pools, golf classes, etc. can open for children and students, and no more than 9 people can use those at the same time. Now, this move comes as the government is trying to be a little bit more flexible due to the business owners suffering from the stringent social distancing measures.
Our government will try harder. We will immediately amend controversial guidelines that are either unfair or difficult for people to put into practice. At places where the sense of vigilance has subsided, we will pull harder on the reins to focus on the implementation and enforcement of our measures.
And now let's shift over to the international updates. Many countries around the world are in concern of the COVID-19 variant from the UK and South Africa. If you take a look at the numbers in the UK, 2.8 million and another record high of daily infections of over 62,000. Also, the U.S. had over 279,000 infections, and South Africa now surpassed 21,000 infections in just a day, standing at 1.1 million. And with that, the global tally now stands at 87.6 million, and some 15,000 new fatalities have been added, which raises the death toll to almost 1.9 million. And those are the updates I have for now. I'll be back in a bit after the government briefing. Sunny?
All right, so thank you. I'll see you back at the desk. Now, for more coverage of the COVID-19 situation here in Korea, I have our Kim Ji-yeon in the studio. Welcome, Ji-yeon.
Good to be here.
Now, Soa touched upon this briefly, but health authorities are cautiously claiming daily cases appear to be on a decline, Ji-yeon.
That's right. Korean health authorities expressed some optimism Wednesday, saying the worst of the third wave in the country appears to have passed and that the outbreak is slowing in the country. They attributed this to the effects of stringent social distancing measures and massive testing, and said they're going to monitor the situation closely over the next 10 days. Korea has extended its level 2.5 social distancing rules, the second highest in the 5-tier system in the greater Seoul area, and level 2 social distancing for other areas until January 17th. Also, private gatherings of 5 or more people nationwide are prohibited during the period.
The slow rate at which the caseloads are falling is especially fragile due to the public fatigue that has accumulated from the extended period of tough social distancing rules. The situation may likely turn on its head if we let our guards down even for a moment.
They pointed to the fact that the average number of daily infections in the densely populated Seoul metropolitan area has fallen to 574 last week, compared to some 709 recorded the week before. Also, the reproductive rate, the number of people that one patient is likely to transmit the virus to, has fallen to less than 1.0 for the first time last week since the third wave. They did, however, say that the remaining 2 months of the cold winter season, conditions that are favorable to the spread of the virus, and possible community transmissions of the new COVID-19 variants are major risk factors.
Right, Sean. Now, as you just mentioned, the new strains of the coronavirus, what measures are in place here in the country to prevent a potential spread of these new variants?
Starting Friday, all air passengers disembarking in Korea, they're required to submit negative PCR test results before they're allowed to enter the country. The test result must be taken less than 72 hours before their departure. The measure was placed on top of the extended ban of direct flights from Britain for 2 weeks until January 21st. Those entering Korea via port, they'll be required to do so starting next Friday. So far, Korea reported a total of 12 cases of the new coronavirus strains from the UK and South Africa, which appears to be more transmissible than previous variants. Mandatory PCR testing will also be required to all U.S. Forces Korea service members flying into the country as well.
And Cheon, speaking of U.S. service members stationed here in Korea, what is the latest with regard to their vaccination campaign?
Well, the USFK is continuing to administer the Moderna COVID-19 vaccines to frontline healthcare workers, first responders, and command center personnel. Among those inoculated were some Korean nationals who are either civilian workers or troops attached to the USFK, and were also eligible for the vaccination on a voluntary basis. Exactly how many Koreans were subject to the inoculation was not disclosed due to privacy concerns, but they became the first Korean nationals to be administered with COVID-19 vaccine at least a month earlier than the rest of the country, which plans to start inoculations in February. So far, the USFK reported 27 new cases this week, raising the total to 513, most of whom have tested positive upon arrival in South Korea from the U.S.
Right, and staying on the topic of vaccines, the Global Health Body, I understand, has disclosed its guidelines on the recommended time interval between COVID-19 vaccine doses. Please tell us more, Cheon.
Sure, the World Health Organization warned that the administering the second dose of the COVID-19 vaccines must not be delayed more than 6 weeks after the injection of the first dose. This comes after the British government has changed protocols for vaccine administration, that the second dose can be delayed by up to 12 weeks after the first dose. The longer interval between doses is part of an attempt to administer the first dose to as many people as possible to reach herd immunity, but it has come under severe criticism, with many experts saying clinical trial data provides little to no support for the 12-week gap. Pfizer, for its part, has said that the first dose alone is not effective past 21 days of the injection, according to its test data.
I see. All right, Cheon, as always, thank you very much for your coverage.
Thank you.
Right, it's time now for the regular briefing on COVID-19 here in Korea for this Thursday. And while we wait for that to start, perhaps we can take a quick look again at the stringent restrictions on gatherings for social purposes until the 17th of January. Social gatherings of 5 or more people indoors and outdoors are banned across the nation. This ban has been in place in the metropolitan region since December 23rd, but has now been expanded to include the entire country as authorities step up their efforts to contain this latest outbreak. The only exception to this ban includes those who live together as registered in their official documents. Also an exception to the restriction on gatherings is that related to business, as well as weddings and funerals, where the cap on attendance stands at 49 or fewer in the metropolitan region, but 29 for funerals here in capital Seoul. Under level 2 social distancing, the cap on weddings and funerals stands at 99 people for those outside, that is, of the greater Seoul area. Meanwhile, ski resorts have been allowed to open doors, provided they place a 1/3 capacity cap on visitors and close doors at 9 in the evening. Also, with the exception of rental stores and locker rooms, all other facilities, including restaurants and cafes within these resorts, are to remain closed. The briefing is about to start. We'll come back to you afterwards.
먼저 권준욱 부본부장의
First of all, we
설명이
have
있겠습니다.
Mr. Kwon Junuk for the explanation.
1월 7일 코로나 바이러스
Let us begin our regular
국내
briefing on the
발생
COVID-19
현황을
situation here in South Korea
말씀드리겠습니다.
for January 7th,
국내 발생
Thursday.
신규 확진자 규모는
As of today midnight, we have 833 new local infections and 37 new imported cases.
총 누적
And the
확진자
total
수는
caseload now stands at
66,686명입니다.
66,686.
어제는 총 10만
And yesterday, we had a total of 102,791 tests conducted. And in the makeshift testing centers in the metropolitan area, we had over 37,000 tests that were conducted alone.
신규로
And also, we
654명이
have 654 more people being discharged, while 17,991 people remain in quarantine. And we have 400 patients with severe or critical conditions, and we also had 19 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families.
1월 7일 0시를 기준으로
And
해서
as of
국내
today
주요
midnight, let us go
발생
through the major
지역별로
updates on local infections by region.
수도권이
First of all, in the metropolitan
623
area, we have a total of 623 patients. Today, about 78% of the total. And in the non-metropolitan area, we have 210, which accounts for about 25.2%. And major cluster infections stem from religious facilities and also nursing hospital. And in Seoul Songpa-gu district, in relation to correctional facility, we have 7 additional cases being confirmed, and a total of 1,113 people have been confirmed to date. And in relation to this cluster infection, we are also carrying out detailed examinations. And starting from tomorrow, they will be subject to the same kind of preemptive testings on a regular basis for every 1 week, as is in place for those who are working at nursing hospitals. And also in Gyeonggi-do Province, Yangju City, we have the food processing company, and we also have additional cases there, and a total of 47 have been confirmed to date. And in Gyeonggi-do Province, Osan City, in relation to a food company there, we also have 12 additional cases being confirmed there as well. And in Chungcheong area, in relation to Chungju City, in relation to a religious facility, we have a total of 50 people being confirmed. And in Okcheon-gun County, in relation to a hospital there, we have a total of 10 people being confirmed to date. And next, in Honam area, in relation to Gwangju City, in relation to the religious facility in Gwangsan-gu district, we identified the first index case on the 31st of December. We have 38 more cases being confirmed, and a total of 62 have been confirmed to date. And in Gyeongsangbuk-do Province, in relation to a Gumi City nurse training center, we have 16 people being confirmed to date. And in Gyeongnam area, in relation to Busan Yeongdo-gu District Elderly Health Center, we have a total of 80 people being confirmed to date. And next, we would like to provide you some updates on the report of the new variant of the COVID-19 stemming from Britain. And on the January 2nd, we have confirmed the first case of the new variant here in South Korea. And we also found another additional case of new variant among the family members of the first case. And in relation to this, we also are conducting conducting detailed genetic sequence testings right now. And to this end, as of January 7th, we also have a total of 15 cases of the new variant. And as for 14 of them are from the Britain, and also the quarantine authorities are exerting our full efforts to monitor the situation, including those countries like UK and South Africa, and we are also having the confirmed cases among these countries who are coming into Korea. We are also conducting our sequence testings, and we are also putting in place intensified quarantine measures for all foreign entrants. And up until now, we have had the PCR testings before all of the foreign entrants are released from self-quarantine, and we have also put on hold in all of the flights flying in from Britain as well. And we also have decreased the level of the body temperature of those who are coming in from Britain and South Africa to 37.3 degrees Celsius. And also starting from tomorrow, we will be extending the flight ban from Britain until the 21st of January. And as for those people who are coming into Korea through UK and South Africa, and these include all of the entrants, including international foreigners as well as Koreans, and we will be conducting the PCR testings upon their arrival, and also they will be subject to self-quarantine and also putting in stationed in one place, and also this will begin on the January 12th, and also they will be stationed at these life treatment centers for self-quarantine. And also, as for those who are on self-quarantine, we have seen that those people who are living with those who are on self-quarantine have tested positive, and we have been upgrading our guidelines so that we are also underlying the fact that these people need to abide by these quarantine guidelines. And next, we have some updates on our major R&D on the vaccines and therapeutics. As for the treatment here in South Korea, we are conducting a clinical trial committee, and under this committee, they have updated the diagnostic guidelines. And to this end, all of those people in the high-risk group, including seniors, as for the antiviral testings, treatment, we will be utilizing remdesivir, and as for those people, we will also be utilizing dexaphone as well. And as for chloroquine, as well as these treatment for malaria, we have seen that these have not been studied to be effective against COVID-19. And as for the medicine that which returns and restricts the HIV protein, we do not also recommend this kind of drug for the patients here as well. And as for now, we have administered the remdesivir to more than 3,100 patients here in South Korea across 105 hospitals. And as for the clinical trial for the treatment, we are conducting the second phase of the clinical trials, and we have been conducting them on 13 hospitals nationwide. And we also have about 6,500 people who have showed intentions to donate their blood samples, and we have about 4,500 who actually donated their blood samples. And as for the safety e-report, we also have some breaches of the quarantine measures that have been reported. A major of them were stemming from religious centers. And when they were filming the online services, also some of the facilities allowed the service members to come in in a booking manner. And also we had some
마스크를
at
착용하지
a
않은 채
clinic
대면 예배를
hospital, we
진행합니다.
also have
또한
some
일반
people who were
가정에서
giving
종교 관련 소모임을
physical
하면서
services,
노래를
and also there
부르거나
were some cases of
대면 모임 등을
people
한
where they
것이
gathered at
신고된 바가
households
있습니다.
to give worships as well and
대학교
singing as
종교인
well.
시험장에서도
And moreover, as
수백
for
명이 모여서
those
시험장에서 같이
test centers
점심
involving
식사를
the
하는
university
사례가 신고되었습니다.
college students, there were
저희
also
당국에서는
cases
코로나19
when
예방 및
more than
확산
100 people
차단을 위해서
gathered
대면
to
예배
have
금지,
group
그리고
meals.
종교시설
So to
주관의
this end, we would
모임 및
like to highlight the
식사
fact
금지,
that we are putting in
비대면
place
예배
intensified
시에도
quarantine
20명
measures
이내로
for religious
영상
centers,
제작 등
and all of the
집합
services
인원을
need to go
최소화할
online,
것을
and
꼭
we also
지켜주시도록
need to
다시
also have a
강조드립니다.
minimum number of people at the
전국 대부분
religious
지역에
centers
한파,
when they are
특보
filming
주의보가 발령돼 있는
these
상황입니다.
online services.
건강을 위해서
And right now, in many of
가급적
the
외출을
capital
자제하고
area, we
행사나
also
모임을
have
취소하는 등
put in place the heavy
사회적
snow
거리
warnings
두기에
and heavy
적극
snow
동참함으로써
advisories as well.
발생
So
질환과
we also
코로나19
ask you to
예방에
comply
힘써
with
주실 것도
these quarantine
부탁드립니다.
measures to protect yourself from the chilly weather.
새해도 변함없이
And in the new
코로나
year,
대응과
as well
관련해서
as for
세 가지
responding to
수칙을
the COVID-19, we would like to highlight the following three
우선
aspects.
모든
First and
사적인
foremost,
모임은
please
취소하고
cancel all of
집에서
your
안전하게
private gatherings,
머물며
and please
종교
stay
활동,
home safe
모임,
and sound,
행사는
and also switch all of your gatherings, religious
번째로
gatherings and religious
장소와
services to
상황을
online. And
실내 및
second,
2m
regardless of
이상
where
거리
you are,
유지가
please wear
어려운
your face masks.
실외에서는
And this
항상
includes
마스크를
whenever you are
착용하고
indoors, and even when you are
마스크를 벗어야 하는
outdoors and you
대면
cannot
식사,
keep a 2 meters
음주,
distance.
흡연과
And
같은
please
상황은
also
피해
refrain
주시기
from
바랍니다.
going into the
마지막으로
environment where you
발열,
cannot wear
호흡기
face
증상
mask.
등 의심
And also
증상이 있을
third,
때는
if you have any
신속하게
suspected symptoms like fever or respiratory
임시
symptoms,
선별 검사소
please go
등을
to the
병원에서
temporary
검사를
testing sites
받으시고
to get tested as soon as
의료기관에서도
possible. And
검사
also at
의뢰서를
hospitals, we
적극
ask the
발급함으로써
doctors
선별
to
진료소에서
provide the
별도의
documents
문진
so that
절차
these
없이
patients who are
신속하게
suspicious of
검사를 받을 수
COVID-19
있도록
can get
적극
immediate
주의해
tests
주시기
at
바랍니다.
the testing sites.
말씀드리도록 하겠습니다.
And last but not least, I would like to highlight the following. Currently, we are seeing the COVID-19 outbreak here in South Korea, and we are witnessing both hopes and concerns at the same time. First of all, we are seeing some positive ends, and the WHO figures show that globally we have a very high tally of the COVID-19. However, we have seen a decrease in the previous 2 weeks in these tallies. And here in South Korea, we are also having the same number of testing, similar number of testings. However, we are seeing an on-week decrease of the domestic tallies as well. And we are also seeing a decrease in foot traffic among students. And we also have the antibody treatment that has applied for the immediate approval as well. And today we do not have any patients who are waiting to be administered to the hospital. And starting next month, we will also begin our vaccination program here in South Korea as well. And next, I would like to go over some of these areas of concerns. In many parts of the world, we are seeing new reports of the new variant stemming from UK. And in certain places of worship here in South Korea, we are seeing some breaches of quarantine measures. And already we have had great pain in the past, and we also are seeing increased fatalities, and also we are seeing 2 digits of fatalities for the time being, and we also have untraceable patients as well. And in the domestic vaccine front, we have entered the first phase. However, we still have a very great gap among those with compared to the vaccines of other countries. And also we believe that many dedications of the medical circles, we were able to respond to the COVID-19, and thanks to their prior experience of dealing with MERS and SARS, we also have a great response among these medical staff members without a big major collapse. And one of the factors fact that is great worrisome is the fact that we have an international variant, and we also have a possible variant that could also mutate and be reported here in South Korea going forward. And we need to also intensify our monitoring as well. And the quarantine authorities also note continuity, and we are also carrying out our preemptive measures. Of course, there are room for improvement, but we will continue to exert our full efforts. And looking at these comprehensive aspects of COVID-19 outbreak, we believe that this was possible thanks to the sacrifice, endurance, as well as the efforts put forth by all of us. However, we are not seeing a rapid decline, and there are also heightened fatigue among the members of the public. The quarantine authorities would also like to note that right now on the site, everything that is unfolding at the moment is also largely due to us who are the quarantine authorities here in South Korea. We will also exert our full efforts until we can contain the virus fully and completely, and we ask for your participation in the social distancing measures going forward until then. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, there was Kwon Jun-wook, Deputy Director General of the Central Disease Control Headquarters, with us. His afternoon briefing. So, what did he have to say?
Well, first off, there appears to be more cases of the COVID-19 variant here in Korea, as 3 new cases were confirmed as of this Thursday, and these patients appear to be family members of a patient confirmed earlier this month, which means now Korea has 15 total cases of the COVID-19 variant, 14 from the UK and 1 from South Africa. Meanwhile, beginning tomorrow, COVID-19 screenings will be carried out at correctional facilities across the nation every week. And this, as just recently, 79 cases were added to the Seoul Dongbu Detention Center.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Now, late December, Antarctica recorded its first COVID-19 cases amid an outbreak at a Chilean base following a trip there by a Navy ship for logistical support. At least 36 coronavirus cases have been reported at the base since then. Now, Korea also has 2 research stations on the continent, and I have Dr. Lee Dae-young at Jangbogo Station live on the line with details on the situation there. Welcome, Dr. Lee.
Yeah. Good morning.
Now, Doctor, I understand there are some 40 research bases there, and there have been no physical interactions among them, and thus observers are claiming the risk of transmission is low. Is this really the case there, and how are Korean staff members at Korean bases doing?
Korea Fall Research Institute operates 2 Antarctic stations. The first Korean Antarctic station is King Sejong Station, located on the coast of Maxwell Bay, surrounded by King George Island and Nelson Island in South Sultan Island, parallel to Antarctic Peninsula of West Antarctica. In Chilean O'Higgins Station, 36 people are known to have been infected with COVID-19. O'Higgins Station is located on another island, about 70 nautical miles from King Sejong Station. Now, I heard there is no issues related to COVID-19 at King Sejong Station. This is a Jangbogo Station, which is the second Korean Antarctic station, well located on the coast of Terra Nova Bay in North Victoria Land. Jangbogo Station is about 2,500 nautical miles away from Chilean Station, and there is no connections between them and us. So we are safe from these Antarctic COVID-19 problems caused by the Chilean station, but we must be careful.
Right, and in order to be careful, Dr. Lee, what measures are being adopted by Korean research stations to ensure continued safety?
All members of 8 Jangbogo Station overwintering team were kept in quarantine for 14 days. On the first and last day of this quarantine, all members were subject to the COVID-19 test, and all received negative reports. After confirming the final COVID-19 test, we boarded the Korean icebreak research vessel Arirang to go to Antarctica the last day of October 2020. It took about 5 weeks from Korea to Jangbogo Station, and all members arrived safely. without any symptoms. And now there is no one related to COVID-19. There is 2 stations around the Jangbogo station within 10 kilometers and are operated by Germany and Italy. Now the German station closed and there is minimal members at the Italian station. The first policy in Jangbogo station is no contact with other stations members. Currently, all members of Jangbogo station are on duty with being in good health.
Dr. Lee, you spoke about taking COVID-19 tests. How are these tests conducted there?
Before we left Korea, we had 2 weeks of quarantine in an isolated place individually and got 2 times COVID-19 tests. All members of COVID-19 test reports were negative. To prevent COVID-19, isolation from others is important. So we got 50 days of quarantine, so we don't need more COVID-19 tests. Arirang has an emergency COVID-19 test kit and room, but there is no test kit at this Jangbogo station. I think this situation is similar to other stations in Antarctica.
I see. Dr. Lee, one final question before you go. What is your priority with regard to the health of our researchers and other staff members stationed there in the Antarctica?
Everybody had got the strict medical check before we left Korea. Every member is healthy. These days, Antarctica is the summer, so possibility of disease due to coldness is low. But all members must be careful at cold weather. Nowadays, we have beach days because the summer season is very suitable for the maintenance of each facility. Therefore, I'm afraid of muscle pain and arthralgia-related work. Some members get physical treatment or stitch a patch on their back, shoulder, or knees. Since April, the polar night will start, so we cannot see the sun for around 100 days. At that time, members need vitamins because of lack of sun exposure and nutrition from fresh vegetables. After all, people complain insomnia or say something is wrong with my conditions. As a doctor of overwintering team, I have to take care of members enough and good sleep. Thank you.
I see. All right, Dr. Lee, thank you very much for making the time to join us live at this hour with your thoughts, and do stay safe.
누적 사망자도 오늘 2,000명을 넘었습니다. 대부분이 요양병원이나 요양원에 계시던 70대 이상 어르신들입니다.
동일 집단 격리 방식을 전면적으로 개선하겠습니다. 요양병원에서 집단 감염이 발생할 때에는 확진자나 비확진자 둘 중 한 집단은 모두 외부로 전원시키고 동질적인 집단만 집단 격리를 실시하겠습니다.
A tragic consequence of the pandemic across the world is the loss of lives. In today's session with our panel of experts, we discuss this sad reality and possible ways to prevent it. I have Dr. Alice Dan from Ms. Mary Women's Hospital. Hello again, Dr. Dan.
Hello.
And I also have Professor Kim Sung-hee from Hanyang University. Welcome back, Professor Kim.
Hello.
Dr. Dan, December has proven to be a deadly month for quite a few countries, including Korea and the US, given the surge in COVID-19 related deaths. Now, how do you explain this unfortunate reality?
Well, for many months now, actually for a year, experts have predicted that this winter season would be the most devastating in terms of deaths due to COVID-19 and an increase of cases. We knew that the cold, dry weather and the fact that people will be spending more time indoors, that these kinds of environmental conditions would enhance the spread of the disease. Also, anytime that there is more gathering and travel, more mobility, the chances of the virus spreading go up. And of course, there were the back-to-back holidays of Thanksgiving, then Christmas, and then New Year's in the United States. And there was a huge surge in cases due to all of the travel and gathering that happened then. Also, even in optimal hospital conditions, COVID-19 is very difficult to treat. But hospitals have been operating on overflow. And so this decreased access to adequate hospital care has undoubtedly led to more mortalities. Finally, we have the added factor of the new mutation. We know that it is more transmissible, and there's a domino effect. When you have increased transmissibility, you have more cases. More cases means more hospitalizations. More hospitalizations leads to more deaths. Unfortunately, this is the unfortunate, inevitable progression of events, and I think that's what's being played out this winter.
Right. Professor Kim, I'd like to extend the same question to you. Korea, for its part, marked a very sad milestone this week with its total death toll surpassing 1,000 cases. What do you believe is the reason for the rise in the death toll here in Korea?
When you look at the data, the case fatality rate was only 1.6% before the third wave. During the first and second wave, we managed very well. But now it has increased up to 3%, which is almost 2 times of the case fatality rate. And first of all, the most important thing is that we have a lot of old age among those who are infected. And everybody knows that the older groups, it's very difficult to save them. The prognosis are very bad. So the more we have, it is inevitable that we will have more death. So it's very important to protect the seniors from being infected. So that's the first thing, that we have many of seniors, mostly from long-term care facility and nursing homes. So that is the first reason. Second reason is that the number we have, around 1,800, 900, it is too much for our health system. It was manageable when we had 100 or under 100, but now every day we have many 100 patients, and equilibrium is now pushing to the direction that health system is fully stretched. So we are sort of struggling at the moment because it takes some time. Once the case is admitted, it takes 2 to 3 weeks to be released. So when we have, for diagnosis, it takes only a few hours. But once the case is in, then we need to wait 15 to 20 days. So the bed will not be available until that time. So it's a matter of the amount of how many we have and how many we have had for last few weeks and how many we have of older people. So that 2 factors are very important.
I see. For those in the vulnerable populations, then prevention is better than cure for them, for sure. Dr. Tan, authorities here have cautiously claimed that the daily number of cases appears to be on the decline. Do you suppose this decline also means perhaps a drop in the death toll in the future?
Perhaps in the long term, we can hope for that. But in the near term, unfortunately, I think we will continue to see a high number of fatalities. Just from yesterday alone, there were 809 new cases. 272 of them were age 60 or greater. That means we can predict that 16 of these cases, just from yesterday alone, will not survive, that they will be fatalities. Also, even though we have seen a decrease in the number of daily new cases, there has been an increase in the number of people who are in critical and severe illness categories. From yesterday, we hit an all-time high of 411 people in this sickest of the sick category. And based on the age distribution, we can predict that another 26 of these people will not make it. They will not survive COVID-19. So just from yesterday alone, we can predict 42 more deaths, imminent deaths in the near future. So although we will probably see fewer deaths, I am hoping maybe in 4 weeks' time, I think in the near future, we can expect to see double-digit fatalities.
I see. Now, meanwhile, using artificial intelligence, a local research team has come up with a model to predict the mortality of patients at the time of their hospitalization through a routine blood sample. I have Professor Lee Jin-seok from Wongang University on the landline with details on this. Welcome, Professor Lee.
Good afternoon.
Professor Lee, let's begin with details about your AI model that can forecast the fate of COVID-19 in patients. How accurate is it?
Yes, so only last year, the number of COVID-19 patients increased rapidly. Because this pandemic lasts longer than expected. We also noticed that some COVID-19 patients had mild symptoms first, but suddenly worsening leading to death. To find out which factors are associated with death from COVID-19, our team decided to develop an AI model with the patient information from Wuhan, China at birth. That is, to predict the patient mortality using real blood information at the early stage, the time of hospital admission. So the accuracy was around 90%. Also, AI says that age is the most critical factor. And for the blood information, AI says low lymphocytes in blood is also one of the most critical factors of the COVID-19 mortality.
I see. Professor Lee, what implications does your mortality prediction model have on efforts to contain COVID-19 here in the country?
Yes. So first of all, we developed a web application where anyone all over the world can access the model to predict mortality. So if AI predicts that the patient is more likely to die, then medical staff can prepare intensive care preemptively, regardless of the patient symptoms, by reducing the mortality rate. Well, with this current explosive increase in the number of patients now, we are facing a shortage of hospital beds. In this situation, I think it is actually difficult to prepare preemptive intensive treatment, even for patients with mild symptoms. Nevertheless, I think that the intensive treatment is needed even for patients with mild symptoms by increasing hospital capacity.
I see. All right, Professor Lee, thank you very much for your insights.
Thank you.
Right, Professor Kim, what tasks need to be tackled to allow for widespread application for Professor Lee's mortality prediction model, do you suppose, at healthcare centers?
Sounds very encouraging. But there are some factors to be examined before we consider whether we can widely use it or not. Most importantly, that should be beneficial for population at large, not only for small group of people. So typically these AI models or machine learning algorithm that start with the training the models and followed by testing in other various settings. So that works. The Professor Lee's model, it worked in certain setting. I think it's the serums are from Wuhan in China, and they are very homogeneous group of people. But then we have a lot of other setting, London in UK and in Korean seniors and other children in Australia. So we should test whether this model is applicable in other various settings as well. Then this generalizability and adaptability, that should be firstly proven. And then maybe we will also consider there is economic benefit of having this technology will save associated health cost.
Right. Dr. Tan, questions have been raised over the wisdom of patient cohorting at nursing homes, and this comes as the venues account for more than half of the country's death toll. Could you start by telling us how isolation is implemented under this strategy of cohorting and the dangers it may entail?
Right, so when there was a huge outbreak in a nursing home or inpatient psychiatric hospital, the strategy was to cohort quarantine all of the patients. That means to keep the patients under isolation in that facility rather than transfer them out to a general hospital. There were many problems with this strategy. First of all, multiple patients are usually housed in one room, and so there was crowding issues, and these the spacing facilitated the spread of the virus from positive patients to patients who perhaps did not have the virus yet. Ventilation most likely was also an issue. In psychiatric hospitals, you're not allowed to open windows because of the risk of falling out. These facilities are not equipped, they're not staffed to deal with high-risk patients. They can't do the monitoring or the treatment needed. And of course, these facilities, they had older people who were frail, who had multiple comorbidities, and they required the highest level of monitoring and treatment. Lastly, in terms of transfer, a lot of times it was very time intensive. It took a lot of time, and in order to transfer a patient out of these facilities, it was met with a lot of uncooperative responses. And so that I think, because of the time lag, led to decreased patient outcomes, poor patient outcomes. And so the government has totally revised how to take care of patients that emerge from these kinds of facilities.
Right, and hopefully we'll see an improvement in the near future. All right, Dr. Dan, as always, thank you for your thoughts, and Professor Kim, thank you for being with us today.
Thank you.
Right, a cold wave alert is in effect here in Seoul as of last night for the first time since January 2018. So do take care against the chilly conditions and do stay safe from COVID-19. Thank you for watching.